Are you struggling with IBS symptoms? Maybe you're struggling with the diagnosis of IBS because all you had was a simple colonoscopy or endoscopy without a whole lot of other testing given. Or maybe you've had a lot of different tests done and you're confused by all the different information that you have. My name's Dr. Terranella, and in this video, we're going to look at 4 overlooked IBS treatment options. We're going to look at how foods can sometimes play a role in IBS, from food sensitivities and food allergies. We're also going to look at the role of digestive enzyme capacity, hydrochloric acid, and disaccharide deficiencies, the role of bile acids. That's when you're going to have bile acid diarrhea. There are stool tests one can take to better understand this, but in practice, typically it's treated with a bile acid sequestrant like cholestyramine. And then the fourth one is going to be on the microbiome and pathogenic microbes. These are some of the tests that we use to really pinpoint and triangulate what's going on with your microbiome in terms of pathogenic microbes. For each one of these topics, I'll give you a little bit on what you can do if you think this might be happening to you. In this video, we're going beyond basic health to help you get a better understanding of what might be causing your IBS symptoms. But the content of this video is not tailored specifically to your needs, so please read this disclaimer before we get into the video details. In this video, I want to explore with you overlooked IBS treatment options. I often call this the low-hanging fruit, or things that are fairly easy to try and implement. One of the problems with IBS is that it's a diverse disorder encompassing many different problems. It's often called a functional digestive disorder, and that's because the function of your digestion is somehow disabled or dysfunctional, and there's many different causes for disruption in that function. Because there's so many different causes and there's not one accepted cause, conventional treatments are mostly aimed at symptomatic treatment. For instance, conventional medicine often has treatments to deal with constipation or cramping and things like that, but there's really no in-depth exploration what could be the actual underlying cause. You may start out with a colonoscopy, and when that's found to be normal, or if it's found to be normal, you get the option to take a medication to help with the symptoms. And certainly another problem with IBS treatment is that it can be hard to actually find the cause. And that's because there are so many different causes. And that's kind of the aim of this video, is to help you kind of rule out or narrow down what some of those causes could be for you in particular. So if you have IBS, there are many different things you could or should do to reveal or figure out what's going on beyond just a colonoscopy. Some of the overlooked IBS treatment options. First topic is going to be on food. That's a big one. There's lots of different things to potentially look at there. Second thing to consider is your overall digestive capacity. Third one being bile acids. And the fourth one being your microbiome. So all 4 of these are going to have some tips that you can take action on right away to see if some of these things might be the underlying cause of your IBS. So first is food. Whether it's IBS-C or IBS-D, you should look at the various ways foods impact your digestion. There's things like food sensitivities, food allergies, high histamine foods, and you can think of these as like the interplay between the immune system and your digestion. Now that could be your immune system and the microbiome, or it could just be your immune system and the overall inflammatory process that could be going on when you eat these foods. There are blood tests for food allergies and food sensitivities, but these tests are prone to error, false positives and false negatives. So typically what I recommend when you're doing these tests is to take the list of foods that you found to be elevated on either one of these tests, or sometimes both, and you eliminate them for a period of time, and then you challenge the foods that were identified. Usually it's going to be about 3 weeks for your immune system to kind of calm down, and then your body will react when you reintroduce that food if it's a problem. Now during the period of elimination, you would also expect, I'm somewhat better, I'm 100% better, I'm 25% better, some sort of indication that you actually are on the right track. But sometimes you don't get that, and when you reintroduce one of the foods, or the second food or third food, that's when you're going to have the response. I did go into this in a little bit more detail in one of my other videos on food sensitivities if you want to check that out. The other topic related to food and IBS is the interaction between the food and the microbiome. And this is where something like a FODMAP diet may come into play. FODMAPs are foods that are fermentable. The FODMAP is actually an acronym for fermentable, and then there are different types of fermentable carbohydrates carbohydrates, oligosaccharides, disaccharides, monosaccharides, and polyols are basically different molecules that are in foods that bacteria prefer to eat, like to eat, and each one of them is going to be found in, more or less in certain carbohydrate foods. When you have microbiome issues like bacterial overgrowth or sometimes fungal overgrowth, you'll get gas, bloating, and discomfort when you consume these foods. And then when you take these foods out of your diet, you may get a lot of improvement in your overall IBS symptoms. So if you take these foods out of your diet and you notice a big improvement, that definitely points to a bacterial overgrowth of some kind. The second thing to consider is the overall digestive capacity of your digestive tract. Do you have enough acid present? Do you have enough enzymes? Do you have enough overall digestive capacity? When you don't have enough of one or both of these, it can often present as constipation, bloating, and sometimes gas production as well. And that's because the bacteria are fermenting the foods. Because you're not digesting them and eating them, the microbes have more of a chance to work on those foods, and you might get more gas buildup from that. Now, a separate but similar problem is a disaccharide deficiency. There are genetic and acquired problems with disaccharide enzyme deficiencies, and disaccharides are basically like two carbohydrates put together. When your body can't cleave the two carbohydrate bond, they basically don't absorb into your body as easily or at all. That ends up creating symptoms similar to bacterial overgrowth. So in this case, you're going to have more possibly diarrhea and could also be constipation too, but depends what type of microbes end up overgrowing from the disaccharide deficiency. Now, if you have disaccharide deficiency, it doesn't necessarily mean you're going to get bacterial overgrowth, but there's a good chance over a long period of time that you would. Now, disaccharide deficiencies can be tested for, and fructose malabsorption is the classic example of this, or most common example. And if you think this might be a problem for you, doing a simple trial of a digestive enzyme may help a lot. You can do hydrochloric acid as well and digestive enzymes, one or the other, and you may want to do them at separate times. Now, if it helps somewhat, but you're still having a lot of discomfort, that's when you probably want to test for either some of the disaccharide deficiencies or possibly some of the microbial overgrowth scenarios as well. If you do have a true disaccharide deficiency, you have to make sure you're taking the enzyme where the deficiency is at. So if it's lactose, you have to take lactase, etc. And if you don't know which one it is, it's not necessarily going to be in every single digestive enzyme that you take. Usually the digestive enzymes you can buy over the counter do have a broad array of digestive capacity, but there's a chance you're going to miss the correct one. So don't rely on taking digestive enzymes to completely rule out disaccharide deficiency. You do have to get the test. I will put a link in the description to a digestive enzyme that we typically use that has some of that broad array of digestive capacity present in it. The third thing to consider is bile acids. So bile acids, when they're low, can lead to more of a constipation type of symptom, but can also lead to fat malabsorption, and you may be constipated for 1 day or 2 days, and then because that fat is not getting absorbed, may lead to diarrhea the following couple days. Bile acids are needed to emulsify fats, and if you don't have enough, they sort of act like a detergent to separate all the fat into smaller globules so that your digestive enzymes, the lipase, can work on that fat. And so if you're not able to do that, you're not going to absorb enough of those fatty acids. This can lead to fat being in the stool and a more rapid elimination or shortened transit time can occur. Usually your stools are going to float as well. Now, this sort of thing can happen for a couple different reasons, but if this pattern sounds familiar, a bile acid supplement may be useful to you. Now, on the flip side, elevated bile acids can lead to something known as bile acid diarrhea, where those bile acids are not getting reabsorbed and leading to irritation in the colon. Now, typically what happens is the bile acids are secreted through the common bile duct and they end up in the small intestine where that emulsification happens, and then lower down in the intestines after it goes all the way through the small intestine and into the colon. That's when you're going to start to get some of the reabsorption of those bile acids. In the case that there's a lot of bile acids there, you're not going to be able to reabsorb all of them, and that's when you're going to have bile acid diarrhea. There are stool tests one can take to better understand this, but in practice, typically it's treated with a bile acid sequestrant like cholestyramine or other bile acid sequestrants that are traditionally used for high cholesterol, but they are used in this case as well. Something as simple as taking some extra fiber can also help this if you are having more of the diarrhea type of scenario. If you have more of a pattern of constipation and you feel like you're lacking bile acids, fiber can help in other ways, of course, for constipation, but in that case, you're going to want to take bile acids. If by chance you do get worse when you take bile acids, for sure the issue is going to be too much bile acids, and you could be suffering from bile acid diarrhea. So hopefully that makes sense. You have the possibility of low bile acids, which is going to present more like constipation, and really high bile acids are going to present more like diarrhea. And in the case of low bile acids, you're typically going to have more stools that are floating. So the fourth overlooked IBS treatment option has to do with your microbiome. In addition to the food and its interaction with your microbiome, you also want to look at the microbiome itself, the good bacteria and the pathogenic bacteria. There is a lot on this topic and a lot of testing and different things you can do to look at this, but some of the clues that this is more of an issue would have to do with some of your personal history with regard to exposure to these pathogenic microbes. So do you have a history of traveling to a third world country, and did you actually get sick? Did you get traveler's diarrhea? Have you had food poisoning before or other known exposures to infectious microbes? As I mentioned, looking at the low FODMAP diet and how you respond to that could be one clue. Couple that with a history of exposure, and you definitely should be thinking more about this problem. In addition, if you've been treated for one of these microbes or been tested before and now you have lingering IBS symptoms, you definitely want to be retested or look into that further. And there's a couple more in-depth videos that I've done on this topic, and one of them has the title IBS Blame Gut Bacteria ? And in that video, I go into more detail on some of the symptoms and testing you can do to identify this. So if you do think something like this is going on, in a lot of cases, you're going to need some antimicrobial herbs or antibiotics in order to treat this. And there's very specific things to get this type of thing under control. So if you think something like this might be going on, or you're captivated by the overall intricacies of your microbiome and gut health, you may be interested in my online course, Getting Past Post-Infectious IBS. With this course, you'll get a much deeper understanding and practical strategies on how to reset or reclaim your gut health. I'll put a link in the description for that if you're interested. And if you do think something like a pathogenic microbe might be responsible for your IBS symptoms, here's some of the tests that we would consider running. So you have a SIBO test, you have the IBS Smart test, you have a stool test, and you also have an organic acid test. These are some of the tests that we use to really pinpoint and triangulate what's going on with your microbiome in terms of pathogenic microbes. And I go into a lot of detail in the course on all these testing strategies and what you should do when you find different things on these. All right, so that's all I had on this video, overlooked IBS treatment options. If you do have questions on this topic, drop it in the comments section. Happy to answer your question. Thanks again for watching. We'll see you next time.